Hello, everyone, and thank you for joining us today for our webinar, Best Practices for Finding Missing Children, partner webinar with the National Center for Missing and Exploited Children. So today we're going to cover a couple topics. The first one from our guest speaker, she's going to be going over an overview of the organization, covering a couple different case studies, best practices, and how the NCMEC works with Nixel. From there, our other speaker, Jim Gata, he will give a quick Nixel overview, cover a couple different success stories, and then we'll open it up to a Q&A session at the end. So just a couple quick housekeeping items. As I just previously mentioned, we will have a Q&A session at the end, so by all means, ask as many questions you like before and during that session. You can do so by selecting the questions drop-down, your GoToWebinar panel, and submitting the question to all panelists. As a reminder, with all of our Everbridge and Nixel webinars, they are recorded, so we will be sharing the recording with attendees in the next coming days. We'll email it to you. If you do not get the email, you can always access this recording or any other webinar recording on everbridge.com. Go to the Resources tab and go down to Webinars, and you can access any of our previous webinar recordings, including this one after today. The hashtag we'll be using today is #MissingKids. If you'd like to share some snippets or add some snippets of commentary, by all means do so. We'll even retweet some of the best ones that happened during this presentation. Feel free to follow us at Everbridge and at Nixel on Twitter, and join our LinkedIn group, Everbridge Incident Management Professionals Group. So with that being said, I'd like to introduce our first speaker. Our first speaker, excuse me, is Lini Kang Sofer, and she is a supervisor with the Missing Children's Division of the National Center for Missing and Exploited Children. She is based out of NCMEC's Texas Regional Office and supervises case management teams in the regional offices located in Lake Park, Florida, Rochester, New York, and Austin, Texas. She's also responsible for various Missing Children Division projects, including initiatives related to children missing from care and child sex trafficking. Prior to joining NCMEC, Lini served as prosecutor with the Manhattan District Attorney's Office in New York City, and also co-authored chapters of a Pennsylvania State Judicial Bench book covering statutes designed to protect children. So with that being said, I'm going to hand it over to our first speaker, Lini.
Hi, Mike. Thank you. Thanks very much. I want to make sure that everybody can hear me. Mike, thanks for the introduction, and also thanks to you, Nixel and Everbridge, for hosting this. And I really wanted to thank everybody who's on this webinar to learn about our role and resources. And so it looks like we have a lot of agencies on from around the country, and some of you may have already participated in some NCMEC-related training. You may have worked a case with us or more than one case with us. And so there may be sort of varying levels in understanding or familiarity with NCMEC, and there may be those who have never worked with us and don't know a lot about our resources. So I'm going to try to go through as quickly but yet comprehensively enough to cover as much as possible, and then hit some of the basics, and hopefully you can also walk away with a new piece of information. And Mike basically laid it out, but I'm going to talk a little bit about this new federal legislation that impacts law enforcement around the country as well as us. Talk about some, yes.
So sorry, I don't mean to interrupt, but are you trying to show your screen right now? Unfortunately, the audience can't see it.
Okay, hold on one second. Yep, can you see?
Not yet. There's a little bit of delay, so let's give it a second.
Okay. And I haven't gone through any slides, so nobody's missing much.
There we go. Perfect.
Okay,
yep,
great. Thanks so much. So I'm going to talk a little bit about this new federal legislation that impacts NCMEC as well as law enforcement around the country, and talk about how we handle cases, about reporting, our resources, some general as well as in specific context, and also try to use case studies in order to really illustrate some points and the importance of information. So for those who are not necessarily familiar with us, just to let you know, we've been around since 1984, and we are a nonprofit organization, and our acronym is NCMEC, and we are not an investigative agency, and so we are here as a national clearinghouse. And what we do is we provide assistance to law enforcement as well as to parents and legal guardians, and that's really basically in our mission to help find missing children and prevent child victimization. And I'm with the Missing Children Division, so this is all going to be focused on what our resources are in the missing child context. And one note that I did want to let everybody know, and you may already be aware, is that this is for free. This is really at no cost to any of the parties. And when we talk about a missing child, we operate under the federal definition of a missing child, which is basically a person under the age of 18 whose whereabouts are unknown to the legal custodian. And we classify our cases into 5 different types internally, and we've got 2 different units who handle these types of cases. So we've got our critical and runaway unit, and then we've got our family abduction unit. With our critical and runaway unit, the 4 case types are non-family abductions, endangered runaways, lost, injured, or otherwise missing, what we call limbs, and then Section 5779. So the non-family abductions are basically the taking, retention, luring, confinement, or concealment of a child by someone other than a family member. So it could be the high-profile stranger abduction case, or it could be where they're known to the family and to the child, but there's no biological relationship. And oftentimes we see mom's boyfriend, mom's ex-boyfriend, a babysitter, or a family friend. And so those are the kinds of cases that we classify as a non-family abduction. Then we've got the bulk of our cases is the endangered runaway, and that is any missing child who is missing on his or her own accord and whose whereabouts are unknown to the parent or legal guardian. And then we've got another sort of catch-all, lost, injured, or otherwise missing, and that involves any child where there are insufficient facts to determine the cause of the child's disappearance or circumstances that put the child at an increased risk. So these are the cases where maybe it's a stranger abduction, but there are no eyewitnesses, or the child disappeared and there is no trace of them whatsoever, or it could be that there's something about the facts or the circumstances about the child themselves, whether it's a medical emergency, whether it's a mental health endangerment, that really rises it to a critical level. So we look at a variety of different factors, including the child's age. And so that you're all aware, children who are ages 10 or younger are automatically classified as limbs with us. And then we have a federal statutory carve-out for young adults. And so that's our Section 5779 case. And those are missing persons that are reported to us when the individual is at least 18 years old but younger than 21. And so the federal statute is 42 U.S.C. 5779, and it's also called Suzanne's Law. We see Section 5779 cases in 2 different contexts. Sometimes it's the critically missing young adult that has to be called into us by law enforcement, and then we'll assist law enforcement with our resources. We also see young adults in the foster care, state care context where they're not yet emancipated. They're still under the care of social services. And so we'll have them where a social worker will call in and say they're still under our care, they went missing, they've been reported to law enforcement, and so we'll assist with those cases too. So those are our young adults, and they have to be under the age of 21. And then on this side, we have the Family Abduction Unit who handle domestic family abductions as well as outgoing international. We try to assist in preventing outgoing international cases to the extent possible as well. And the family abductions involve cases in which there is the taking, retention, or concealment of a child, and this time by a family member, and that's in violation of a custody order, some sort of court decree, or other legitimate custodial rights. And so we also see these in the social services context where the state agency actually has guardianship over the child, and the biological mother or family member who no longer have rights maybe take them from a visit or kinship placements. And so we handle those kind of cases as family abduction cases. Now, when we're talking about numbers, I just wanted to give you a brief idea of what we're really talking about in terms of breakdown in cases. And so last year in 2015, we received more than 13,000 missing child cases. And then of those, the bulk of the cases were 86% endangered runaways. And to drill down just a little bit, but this is also a website. It's on our general website of missingkids.org, but under our key facts section, just so that you have an idea of what we're talking about in terms of the other kinds of cases that I just mentioned. So 86% were our endangered runaways, 10% were family abductions, 2% were those lost, injured, or otherwise missing, 1% were non-family abductions, and then 1% were those critically missing young adults that I talked to you about with the Section 5779. And then in 2015, just because child sex trafficking is a pretty hot button topic these days, we saw that of the cases that were reported to us, 1 in 5 of those endangered runaways were likely sex trafficking victims, and that's up in numbers from what we saw in 2014 of 1 in 6. And we saw a really big intersection between those who were likely sex trafficking victims and those who were in social services or foster care when they went missing, and that was 74%. And so I think that in response to what was being seen sort of nationwide, back in 2014 of September, there was legislation called Preventing Sex Trafficking and Strengthening Families Act, and we just call it HR 4980 for short purposes within NCMEC. And that was passed, and it was essentially it's federal legislation, and it's really geared to improve the lives of children in state care or foster care. I don't know how many of you on this call have actually heard about this, but because it does impact local law enforcement, I did want to at least mention this and let you know about this legislation. There are a number of different provisions related to HR 4980. Some of the highlights, and it really has to do with the state agencies and how they have to determine services, and it's about documentation and reporting. But there is one section that is relevant to us here on this webinar, and that is that agencies are now mandated to respond to children who run away or go missing from their foster care. And there's a specific section that says, the state agency shall report immediately and in no case later than 24 hours after receiving entry information on missing or abducted children or youth to the law enforcement authorities for entry into the National Crime Information Center, NCIC database of the Federal Bureau of Investigation, and to the National Center for Missing and Exploited Children. So this slide is just really a timetable. State agencies had about a year in order to come up with protocols and policies, and our understanding from our outreach around the country is that there are still some counties and agencies that are developing these protocols. And then the outside mandate of reporting these children missing to you and to NCMEC is by September 29th of 2016. And we've seen a lot of reports actually from jurisdictions who have not traditionally reported to NCMEC, even though we have received a lot of these runaway cases. And so because of that, and to gear up for the new cases that were going to be coming in by the fall of 2016, and we really think that there's going to be more coming once that deadline mandate comes up, is we did a number of different things. We created a webinar series for caseworkers, social workers. We did a lot of outreach to social service agencies. We tried to do outreach also to law enforcement to the extent that we could. We created a specialized microsite, which is housed on our regular website. And so if you put this into our browser, that's cmfc.missingkids.org. You'll see these images, and this is all information having to do with children missing from care, how social workers can report to us. We did a sound policy recommendation document for them so that they could use it as reference material when they were doing their own protocols. And then, so this is the big page with the resources for social services. And then we also created an online portal for them to report, and I'll talk to you about that in a few more slides. And then this tab is just what we do, and that kicks out to the regular website of missingkids.org. So in the children missing from care context, and if you have any questions about this afterwards, I have my contact slide and information, but we've been doing a lot to respond to and gear up to this federal legislation. And so we are trying to have a streamlined process. We do assess their criticality as much as we can. If there are repeat cases, we try to assign it back to the same case management team so that they get to know the child, their habits, who they're hanging out with. We do have a specialized child sex trafficking teams and staff members, and then we try to utilize as many of our resources. We contact social workers, we contact law enforcement, and then there's biometric collection in long-term cases, and I'll hit long-term cases in a few more slides. And then when I talk about our child sex trafficking team, this is just a summary of our resources. You may or may not have received reports from us, but we formed the sex trafficking team back a few years ago, and it really started out on the analytical front where we were trying to get a coordinated approach to any request from law enforcement regarding child sex trafficking. And then case management teams were added, and so they'll closely coordinate with you and the parents and legal guardians. They're going to try to get as much information as possible. That all goes to our analysts, who then utilize all of our databases in order to try to provide as much of a comprehensive biography that they can on both the victims and suspects if we have information on them. And then this is in conjunction with our cyber tip line report that you also may be aware of, where members of the public and electronic services then send us reports of different online victimization that they see, including child porn as well as child sex trafficking. And then something you may not be fully familiar with, and in doing these webinar series for the child welfare field, we have heard that people were not necessarily aware of victim services support, and this is really both in the sex trafficking context as well as general. But we have a family advocacy division. They're master level trained mental health professionals. They work with families. They work with service providers. We make referrals to Team Hope. That is a peer support network, and that's comprised of family members who themselves have experienced a missing child incident or exploited child, so they can really relate to these parents in a way that those who haven't experienced it can't. And so there are a number of resources that they try to find locally for them, including any crisis intervention services. They help with long-term reunifications. We've utilized them with family abduction cases where maybe 8, 10 or more years have gone by. We connect them to law enforcement, to the people who are assigned to handle that case, and they work hand in hand in order to try to make the reunification go as smoothly as possible. And then we have our child sex trafficking team victim services support also. So in conjunction with family advocacy division, and we have a program specialist. So they'll work with social workers, and they'll also call back law enforcement to the extent that you guys have any questions, but they'll walk through social workers in terms of how to elicit and get that disclosure. That's really hard because a lot of these victims won't tell when they're initially recovered. But once we get that disclosure or we find out specific information about them related to child sex trafficking, it opens doors to other sex trafficking related services. And so we can assist with that as well. Now moving on to some nuts and bolts and in terms of what type of information we seek, what are the reporting mechanisms that are available. So the traditional one is calling our call center 1-800-THE-LOST and speaking with one of our call center specialists. And they'll take calls from legal guardians, non-legal guardians, they take calls from law enforcement. This is where also the Nixel alerts go. They'll first go to the call center, who will then take a look at the alert if it relates to a missing child or a juvenile. Then they'll follow up on these alerts, and whatever appears to fit within our congressional mandate, they're going to call back law enforcement and offer our assistance. They handle leads, they handle initial calls, they handle also Amber Alert information. And then the second mechanism of reporting, and this is currently in place right now only for the caseworkers and social workers, and it has to be somebody who's a representative of the agency that has legal guardianship, but we did create this reporting portal. There has to be a law enforcement report in effect, and this is where they can go and make a report, and so this is an online mechanism. We try to create that sort of a fast, convenient way to do it, and so that's currently what we have in place for those agencies. And we collect a ton of information, and you may know this from even sitting on the phone with us and talking to a call center specialist, but we'll get as much information as possible, and whether it's aliases, nicknames, so that we can do social networking, searches for everybody, scars, marks, and tattoos. They can be really helpful in terms of current, ongoing, fast-paced child sex trafficking investigations. They're also very useful for long-term cases in the event there are unidentified human remains that we need to see if there's a potential match. We try to collect as much companion suspect information, internet information, and that's all with the goal of assisting law enforcement and getting everything together in reports, so that analytical reports that we can hand over to law enforcement. And then we also keep tabs on what we call endangerment information, and these are the things that elevate a case. What are the risks? What do we need to do? What resources can we apply? And when do we need to do it? So this is the kind of information that we seek. And then once we've collected all of this information at the intake stage, then what happens is it's going to get assigned to a case management staff member. And then how do we assist? So the case management team will coordinate all the resources for law enforcement, and they're going to provide as much support and guidance to families. And sometimes they can be that conduit between law enforcement. If you're out in the field, on the ground, and you're responding to a critical case, to the extent that you allow the contact and case management teams then will reach out to the family members. They'll offer support and guidance. They'll do referrals like to the Family Advocacy Division and to Team Hope. And they'll try to maximize our resources at hand. We do have case managers that are on call after hours on a rotating basis. So essentially, we get something during normal business hours. We've got our staff members that are in the office, and they'll respond quickly. And then for after hours, we've got a critical and runaway unit case manager who's on call. We've got a family objection unit case manager who's on call, and they'll field any requests for assistance and immediate sort of critical nature cases, it'll come through the call center, they'll get contacted, and they'll make outreach to law enforcement and see, well, what is it that we need to do? Do we need to deploy any on-site assistance through our Team Adam consultants? What is it that we can provide to law enforcement on scene or behind the scenes? Once the case is intaked and once it's assigned, the case management staff, they're going to call the legal guardian to the extent that that information is available, and they're going to call you. They're going to call to verify intake information and try to obtain additional details. The more information that we can get about a child and the circumstances of their missing event, whether it's critical, whether it's not, the better. And then once initial contact is made, staff members will continue to contact you and try to see if there are any updates. Is there any new piece of information that might be helpful? And this is really towards the view that what else can they do? Is it that, okay, somebody said that they saw Jane Smith and now she's in this particular area. Can we retarget our posters and so that we can try to generate as much publicity in that particular area, even though it may be miles from where she originally went missing from? Can we do a media blast? Is there new information on a potential companion that we can run analytical reports for you? So this is why they try to verify and also obtain more information. And through the pendency of the case, they're going to also try to reach out and see, is there anything else that we can do? Is there new information that we can assist with? Now, this was taken from the webinar that I do for social services. And so this is, they're all 17-year-olds missing from foster care, state care. They're all unrelated. But it is, I just wanted to use a few case studies to sort of illustrate how different pieces of information have been really helpful in helping recover a child. And so we may not know that it's this little piece at the outset that might lead to that recovery, and we do really encourage everybody to give as much information as possible because there's always that potential. And so just very quickly, we had a 17-year-old, she ran away from a group home, and that was a state down in the South. And the social worker actually maintained contact with her through her Facebook page, and from there she was able to get a cell phone number that was associated with the missing juvenile. They gave us that telephone number. We facilitated contact between the law enforcement investigative agency as well as the social worker. Law enforcement was able to start identifying activity on the cell phone. They actually were able to get information and address in a state in the Northeast. So they coordinated with local law enforcement in that northeastern state, where then they found the missing juvenile with a pimp in the motel room. So they were able to arrest the pimp and also save her from any additional victimization that night. When we talk about system involvement or history, this one was actually a pretty neat recovery in which we had a 17-year-old, again, unrelated to the one that I just told you about. She went missing from a foster home in a state that was in the Southwest. Law enforcement, both the detective and the social worker knew that she had been arrested in a state on the West Coast. And so they gave the case management team that information. The team then contacted the arresting agency and learned that actually there's really a lot of information about this juvenile, including some alias information and potential pimp information. With this information, they went back to the detective and they said, hey, we found out this information. Can you put this into her NCIC entry and connect this with, list the potential pimp as a person with information, and then also here's some aliases. And so the detective did. And then a few months later, and unbeknownst to this patrol officer who was patrolling this motel parking lot, and I don't really know what the predicate was for him approaching this particular male subject, but he did, and when he got his name and ran him, there were some warrants that came up in the system, as well as the fact that he had been listed as a person with information on a particular juvenile. he saw a female juvenile. It was pretty clear in the going towards the motel room. It was pretty clear that they knew each other. And so the male subject said, "Oh yeah, that's my girlfriend. Can you give my personal property over to her?" The officer then went and asked her for her name, and lo and behold, she gave an alias that was listed in her entry, and it came up in the context of a missing juvenile that he may not have otherwise known about. And so they were able to arrest the male subject, and they took her, they recovered her. The district attorney in that local jurisdiction actually had some good resources into local child sex trafficking facilities, and so there was a successful recovery in that. In this particular case, we had vehicle tag information. This was a 17-year-old. She was seen running, leaving her group home. Somebody from the group home wrote down the license plate to the car that she got into. We have, the social worker gave that information to our case management team. We put that into our records. Our analysts then they did some regular searches, but also we have access to the Learn database. And through that, sometime later, we got a hit that this license plate and the car associated with this license plate was found in a particular location. So with that hit, the analyst then did a number of different searches around that area from where the hit came from, and came upon a residential address very close to where that car had been last seen. We provided all of that information to local law enforcement, who then coordinated with the FBI. They went to that residential address, and they were actually able to find the 17-year-old, who is going to age out of the system soon anyways, and this had marked her, I think, over 30th run that we were aware of with NCMEC, but on this occasion, at least, they were able to find her and recover her and then resolve that particular case. And then the importance of information actually extends to recovery information. I had earlier referenced, we do have repeat runaways, and so we ask for details of the child's recovery. So if you get those telephone calls or emails from us, this is why. And so we try to get as much information as possible, and we keep a log of all of that information. And then we recommend, especially with social workers, if there are any other marks or tattoos that this child got while on the run, then to document those or photograph those. And depending on the length of the run, get a good photograph of the child upon recovery, because if they go running again, then we can assist with those cases, and we do. And then we know in the system sometimes they're called the frequent flyers or the chronic runners. And sometimes we are and can be that consistent factor who can link the previous run information for law enforcement as well as for the social workers or caseworkers, and then also get new information from each run, and then get that detailed information that can help with future recoveries. And again, we try to get that back to the same case management team so that they become familiar with the child, and so that they can help with those cases. Now, in terms of our resources, the most visible is our NCMEC poster. And so that you know what our basic requirements are, for us to do a poster, they have to be an NCIC. And then we need to just sort of verify that the of the child for our posters. We need a release and verification. We get those from law enforcement, and we also can get those from the legal guardian or parent. And then obviously we need a good photograph of the child. And then what do we do with those posters once we have met the requirements and we get them up? Well, we target them geographically, and we utilize as many photo partners as we can. So we've got our Velasquez Red Plum. You've probably seen these in your own mailings, and these reach about 100 million households each week, and that's through different multimedia channels. We've got Walmart that you're all familiar with, and they feature our posters in over 4,600 stores in the U.S. We've got access to News Distribution Network, NDN, and they feature our posters on their news internet sites. We've also got some internal programs that we utilize, and then we also have our Facebook page. So if you haven't liked our Facebook page, this is not a plug for you to do so. We do, for those who have liked our page, we geo-target our posters, and we do general Facebook postings of our posters by location. And that's usually from where they went missing, and also if we know and where they're believed to be. And our case management teams can coordinate with our communications media department, who can take it a little step further. They can target by age, they can target by geography, interest. We once had a juvenile that we were aware liked a particular band, and we knew that they were going to go try to see them play. So what we did was we had targeted everybody who liked that band, and then also found out the locations where they were traveling. We've targeted homeless shelters before who shared our posters with intake specialists. We had an outgoing international family abduction case where we utilized media outlets, and there were some international capabilities as well. Our media communications department, through coordination with our case management teams, they can do blast out in certain cases. And so in this particular case, we had 2 juveniles who went missing together. And so we did, our media communications department reached out to media in this vicinity, and they went missing from this, and I thought this was just a great visual. So they went missing from this location, and then we blasted the area and asked for local media's help. And then we actually were able to receive leads. These are the leads that we received. And so there was a sighting there. There was a sighting there. There's a lead there all the way up almost 600 miles away. The last sighting was very close to where they were recovered, and that was about 600 miles from where they went originally missing. We had another case where there was a couple, they went on the run. Our media communications department, they sent it out to about 78 different media outlets, and it generated about a number of 50 different stories. Somebody actually recognized the couple, I think at a restaurant. They delayed them, and it turns out that they had had a suicide pact, and so that was terrific in terms of being able to help with that. And then our case analysis division, we have access to publicly and privately donated databases. Our child sex trafficking analysts, as well as our general analysts, that cull through all of this information, including our own internal databases, and then we'll do these reports that'll get sent to the case management teams that are only sent to law enforcement. We do not send these to any non-sworn law enforcement officers because of the sensitive nature of the information and because of our agreements with some of the privately donated databases. And then they also receive some alerts through some of these databases. We had a 31-year-old case. She was a 16-year-old who went missing in 1977. She went hitchhiking. She was never seen again. We did a bunch of posters, age progressions. We tried to do some analytical reports, but there's really nothing that came up. And then through a database that we have donated, we got an alert that there was an insurance applicant that matched the child's full name and date of birth. And so this information was provided to law enforcement, who then was able to confirm her identity and able to close their case. And then we've got our federal partners, many of whom are actually located on site, and this is our headquarters building in Alexandria, Virginia. We've got a number of different liaisons who can assist with different aspects. We've got a postal service liaison who can verify that mail is being sent and confirm certain things. And we've got the FBI. I'm not going to name everybody who's on here. We've got U.S. Marshals. Many of you are familiar with U.S. Marshals and their capabilities. We've got ICE. We've also got military. We have 2 military liaisons, both Army and Navy. And so if you have any cases involving anybody who is currently active or retired from the military, they can also assist in pulling records for you. And then in terms of some of our other just sort of specific division resources, I did want to touch upon the children missing from autism because we've been seeing so many fatalities, and because now there's so many, the CDC basically estimates that 1 in 68 have been identified as having or being on the autism spectrum disorder. And so what we have is an elevated case management response. We'll deploy our Team Adam consultant if necessary. We created an investigative checklist for law enforcement, and then you can see all of these things on our missingkids.org autism section. But because time is of the essence, we do have an elevated response to children with special needs, especially those with autism. And then in terms of critical cases, I told you about our on-call case managers. Team Adam, I have a couple of slides following this. I'll give you a little more detail about that. Our call center, we do the secondary dissemination of Amber Alerts, and then we do have some emergency photo distribution capabilities. Now, Team Adam, there are retired law enforcement. They act as our consultants, and they go on site, and they are our rapid deployers. And these are cases in which there are serious cases of missing children, and they're critical in nature. They go to help law enforcement on site and also families as well. And in one particular case, they were deployed. We deployed two in a high-profile case. They helped with billboard notifications in surrounding states. They helped with the case manager in terms of facilitating social media coverage and posters for distribution. They helped with getting topographic maps, and then coordinated with one of our federal liaisons when I talk about military service to pull public and military service records for the abductor that had been identified. And so they are there to assist in whatever capacity possible, and they will coordinate with the case manager, who will then get as many resources as possible for law enforcement on site. And then to the extent that if there's no recovery immediately, we do have resources in long-term cases. We do our age progressions. This is JC Dugard. This is, she was abducted and held for 18 years, and so this is the age progression, and this is what she looked like when she released her image for the first time after being recovered. And so we asked for reference photos for family members because it is an estimation, and they try to spark recognition. There are cold case reviews that we can offer. We have a partnership with NAMIS, the National Missing and Identified Person System. That's a free online system. If you haven't gone on there already, that's readily available to medical examiners, to coroners, to law enforcement, to members of the public. And then we have folks who help with those who are identified and with unidentified remains, and trying to match them with missing children if we are aware of them. Project Alert, that's another team of retired law enforcement professionals, and they will go out in the longer term cases. They act as volunteers. They'll help facilitate biometric collection, getting information on missing as well as unidentified children. On the unidentified side, they'll go out and they'll meet with the investigative agency. They'll try to help review and collect comprehensive case information and materials. And so this is just an illustration of a deployment and how it resulted in a lot of information and some recommendations. We also have a subgroup of volunteers that are retired law enforcement, as well as medical examiners, medical legal death investigators, some forensic anthropologists. And so we have that resource. And do a very quick rundown. This is, again, another foster care child, but this is how all of these resources kind of came together in a long-term case. She was 16 years old. She ran away from her foster placement. She found out her biological father had passed away, and she got upset, and so she left. And we deployed, a few years later, we deployed our Project Alert volunteer. He went and talked to law enforcement. He also talked to the foster mother. He was able to get medical and dental records from her. We got those coded by a NAMIS odontologist. Several years later, there were actually partial remains that were located in a park near where she went missing from. And it was actually the local county medical examiner's office that looked into a possible connection between the remains and this particular child's missing case. And so 3 days later, actually, the county medical examiner's office was able to make a positive identification through dental records that were available. And so while very tragic and sad circumstances, they were at least able to put a name to the remains and then also bring resolution to the missing child's case. And then quickly on international cases, because I do want to hand it over to Jim relatively soon and then leave time for questions and answers. This will illustrate also our breadth and our abilities in international cases. We see in the runaway context and family abduction context where they run to or are taken from the U.S. to another country. And we had one particular youth. This was another group home situation. This was her second case with us. Both the social worker and law enforcement had previously been aware that she had been recovered in the U.S. Mexico Tijuana border area when local law enforcement had picked her up, and back then she had been commercially sexually exploited. When we got this case again, we coordinated with our FBI liaison who reached out to their LEGAT FBI person in Mexico. We had the poster translated into Spanish. We sent it to our consulate contacts as well as the FBI down there for distribution in the Tijuana area. We also sent it to Walmart that I had showed you was our photo partner to include a zone. And so Walmart goes by zones and they include several different states. And this included 3 different states for that zone, including the one she went missing from. Well, we got a lead from a caller who said he recognized her from our NCMEC poster from his local Walmart store, and it was in a completely different state from where she went missing, but he had seen her the previous week while visiting this small resort town in Mexico, and he was aware of her general vicinity and that she was living with her mom. So upon receiving that tip, we coordinated with law enforcement as well as an ICE contact down in Mexico. And then really within days of receiving the lead, she was recovered. And then she admitted, yes, she was actually, her mother was forcing her to sell herself under a bridge. And then she was taken into Mexico's equivalent to social services custody. So I know that that was pretty fast, and this is all of our NCMEC programs and services, many of which I hit during this presentation. But these are all the services that we do provide. And then just to end, before I hand it over to Jim, and he's going to talk to you a little bit more about some housekeeping matters, I did want to talk to you a little bit about Nixel and NCMEC. So we formed and got together in 2014 to really join forces and try to help you find and locate missing children. And it all goes back to the concept of time is of the essence and trying to use all the tools and technology at hand to assist in that. And so, and just most recently, we actually got a Nixel alert regarding a missing child. I think this was last week, and our call center specialist reached out to law enforcement, offered assistance, and then we were able to get it to, because it involved a child with special needs, we were able to get it to a case manager who then started coordinating with law enforcement and had arranged for a Team Adams deployment. We've seen where a lot of children have actually been already located, so that's terrific. And if they remain missing and law enforcement indicates that they would like assistance, then we'll intake the case and then assign it to a case manager. And so we're able to get up posters. The Nixel alerts are actually really also helpful because although shouldn't be a substitution for NCIC entries, and there are times when Amber alerts are not approved, and so we've got them in the Nixel context. And so you should still enter, into NCIC, and if it's critical, contact us. But Nixel has been a terrific tool in terms of the information and the kind of information that we're seeing in these alerts, as well as photographs that are readily available that we can get really quickly right away to get our posters up. And we have also received alerts that are child porn or online enticement oriented. So those get processed and funneled to the appropriate people in our exploited child division. So with that, this is my contact information. This is my last slide, and I really wanted to thank everybody for coming on. You're all on the front line. Big heartfelt thanks for everything that you do, for all your work, for fielding our calls and inquiries, and we know that they are many. And I hope that I have put into context at least, some of the reasons why. And we appreciate everything that you're doing out there in the public, your work in helping find these missing children, no matter what the circumstances are. So we greatly appreciate it. We really enjoy working with you all. If there are any questions, please don't hesitate to contact me at this contact information. And without further ado, and Jim, I'm sorry if I cut in too much into your time, I'm going to turn it over to Jim. Thanks very much, everybody.
Thank you. Again, this is Michael Scott, so thank you again, Leamy. So we're going to switch over to Jim now very quickly, and we'll make sure we allow for some time for Q&A. We'll probably have to go over a couple minutes, so if you do have to jump, that's okay. We will be recording the session and sending it to all registrants and attendees. For those of you who have not heard Jim present before, just a quick introduction of him. He is our Director of Community Engagement here at Everbridge and Nixel. He helps a lot of our customers build their resident opt-in databases, put together different materials for them, and helps them with message construction outreach to get residents aware of their solution. He comes from us from Nixel as well prior to the acquisition. And with that being said, Jim, I'll let you take it away.
Great, thanks, Mike, Leamy, for that behind-the-scenes look at how NetMEC works. And thank you, everybody, for attending this webinar. We really appreciate your time. I just want to take a few minutes to talk about how everything that Leamy laid out works from sort of a Nixel perspective, as well as an Everbridge one for folks on this call who are using Everbridge. But the Nixel and Everbridge teams are really very proud of our partnership with the National Center for Missing and Exploited Children. We've been working with NCMEC, as Leamy pointed out, for about 2 going on 3 years. But in speaking with a lot of agencies over time, we've learned that many of them were unfamiliar with what this partnership means for them, or even that it exists at all. If you're one of those agencies that's hearing about this for the first time, or just want to learn more, then I am going to take just a few minutes to talk about this from the perspective of a Nixel user. Right off the top, every Nixel agency benefits from this NCMEC partnership, and I'll go into more detail on that in just a moment on exactly how that works. If you're using Everbridge and you do want to learn more about how you can take advantage of it, I'd ask you just to submit a question in the GoToWebinar question panel, and we'll get that answered for you. I use Nixel and Everbridge in the same sentence because, as a lot of you know, and as Mike pointed out, we are the same company, different product offerings depending on a department's need and its size. Everbridge acquired Nixel in 2014, and where Everbridge is primarily used by emergency management at a large city, county, or state level for things like emergencies, severe weather, homeland security threats, Nixel is most often used by law enforcement, typically public information officers at smaller to mid-sized municipalities for emergencies, but also for day-to-day community engagement with residents. So we brought our 2 platforms together to sort of offer that best experience for the smallest rural township right on up to the largest cities in the country. Missing persons alerts are a really big part of that. So from young kids to the elderly suffering from Alzheimer's or dementia who've wandered off. And you know, you're basically leveraging the eyes and the ears of an opt-in network that's over 3 million residents strong, with over 8,000 public safety agencies tapped into that network, including NCMEC. Nixel does remain the fastest growing secure notification platform that's been built exclusively for public safety with input from our public safety partners. So the main reason for that growing network is all the different and simple ways that folks can subscribe to your messages. Because they can do it easily from their mobile phones, you get a much higher opt-in rate than if you're asking them to go to a web portal to sign up. They can go online to do a full profile. They can fill out a widget that you put on your website or download a resident app, but they can quickly enroll just by texting their zip code to the number 888-777. A lot of you who are on this call are very familiar with that, but I definitely wanted to point that out for folks who maybe are not as familiar with the system. So when they do that, you've now captured their cell phone number, which in the case of a missing child you're trying to locate, you can send a notification with their description, their last known location, any photos, any detail that will help find that child and reunite them with their family. Even though it's a text message, you can include pictures, you can write up to 20,000 characters of text, which you're sending directly to all of your subscribers. Those are zip code opt-ins. You can also create keywords if you want to target a segment of your population who've texted a word that you create to 888-777. So maybe you want to create a text distribution list specifically for missing persons or wanted persons. Or in a lot of cases, agencies use Nixel to communicate directly with the local media for press release and story updates. A little off topic, but keywords are great for big events also, where you're doing crowd control for things like a parade or anytime large crowds are gathering. Depending on how residents signed up, whether it's from their cell phones or online or through the app, you can send your messages across several different channels at once. So text, email, the mobile app. You can ring up phones with pre-recorded messages. You can hit social media if you're using Facebook, you're using Twitter. You can even get your alerts to appear at the top of Google search results, as well as Google Maps and on Google Now, and that's part of our Google partnership, which should definitely be the topic of a future webinar that we're doing. While in the case, in the case of a missing child, though, where time is of the essence, you want your message in front of as many people as possible, as quickly as possible. So I wanted to, because it bears some repeating, I wanted to walk you through the steps of how our Nixel our NCMEC partnership works with Nixel. So when it does come to that partnership, all you need to do is send out the message and we do the rest. Basically how the partnership works is Nixel on our back end provides a direct feed to NCMEC of all public notifications that are sent through our platform. So all of those 8,000 plus agencies that are sending messages to their residents all get fed directly to NCMEC as well. NCMEC runs keyword searches on all those notifications. They're looking for specific hits on terms within your messages like missing, runaway, juvenile, many other search terms that they look for. And as Limi pointed out, if there's a match, a case manager will get in touch with your agency, with the agency that's sending out the message to offer their help and their resources. And if that help and resources are needed, then they intake that case and they provide resources which come in different forms depending on what's needed or asked for by your agency. So not only are you getting help from the residents who you've sent your notification to, folks who can be on the lookout for that missing child, you're also getting support from NCMEC and its experts and its network of resources. All that from a single message that you've sent from your laptop or your mobile phone just moments ago. Over the years, and I've only got a couple slides left, and then we can get to any Q&As we might have. Over the years, there have been many cases in which a diligent person has received a Nixel notification where they've seen a child in question walking along a road or in a store parking lot or on a playground, and they've called 911. Some of the kids have been taken by a family member, or maybe they'd run away or had just mindlessly wandered away from their parents. Many of these cases involved autistic children, as Libby also pointed out earlier, and many have been spotted and reunited with family within minutes or 1 or 2 hours of the alert going out. That's really the power of having all your bases covered, right? Some subscribers will find a child after getting a text directly to their phone. Some saw it on an email. Some saw it on Facebook or on Twitter because the alert was, also posted to social media at the same time, or from the local news report because a reporter received the Nixel alert and tweeted it or blogged about it. If you'd like to see any more success stories, I'm just kind of going through a bunch of these. If you'd like to see any more, I just urge you to do a quick Google search on terms like Nixel and missing, and you'll see many more examples of this. Before I wrap up, I do want to go into the database for a minute, show you the messaging page, and essentially show you the interface that you use to send out a message and how quickly you can do something like that. So this, as many of you are familiar with, is the Nixel messaging page. And in order for NCMEC to receive your messages, as well as obviously your citizens, it's just as simple as choosing a priority level. Any priority level, essentially low, medium, and high alert, no matter which one you pick, they will all get fed over to NCMEC. But you will choose one. You will type in an SMS message, missing 12-year-old, give a location, give a description. If seen, call 911. You can also, at the same time, create an email, start up a web message that'll appear online for folks to see. If you have photos of the child, you can easily attach them. We'll do missing child JPEG. You choose the group or groups that you would like it to hit. Again, all these groups will also, on the public side, feed over to NCMEC. If you would like to do point and radius to filter geographically, perhaps the child was just reported missing, so you're going to do a quarter-mile radius. Maybe you want it, from the location where they were left. If you haven't heard anything in a half hour or an hour, you could expand that radius. You can keep expanding that radius as more time goes by within those crucial, 24 hours of a child going missing. So you can keep expanding the radius and the scope of your message, or you can do all of your citizens at once. Perhaps you have jurisdiction over a smaller town. And then if you have Twitter, if you have Facebook, you can send it simultaneously, preview the message, and hit send, and it'll get right out to your people. Sorry, I missed something here. It'll get right out to your people with the picture. It'll go to NCMEC, and NCMEC will start off their process for contacting you as well if it is a missing juvenile case that they can that keywords hit on. That wraps it up for me in the interest of time. I just wanted to kind of give you a little overview of the partnership as well as the messaging page. Mike, I'm going to hand it back over to you for any questions that we may have for Leamy or myself.
Thank you, Jim, and thank you, Leamy. So at this time, it is top of the hour at 3 p.m. Eastern. So anyone who does have to drop, by all means, don't worry. We will have the recording available and be sending it out to all attendees and registrants. So for those who can stay, please continue to submit your questions. You can do so by selecting the questions drop-down in the GoToWebinar panel. We have a couple questions already that have come in, so I'm going to start addressing those. So let's start with our first one. Our first one is from Julie. She wants to know, Jim, how can Nixel help spread information regarding missing kids? And a two-parter, I guess, is for this question is, what are some of the best practices for those messages? Basically, what should she include for her agency?
Sorry, I was on mute for a second. Absolutely, great question. That really is a two-part question in the sense that your first best practice is to do what you can to build up your database of opt-ins because you do want to. Your message is only going to be as effective as how many people you have on the receiving end of those messages. So when you do have a Nixel notification system, you do want to build that network, and we do have some best practices that are on our system that will also be some updating and releasing soon about how to get the word out about texting your zip code or texting a keyword, whether it's doing a press release, going out to local school districts to try to get parents to opt in as well, or pushing messages out to Facebook and Twitter. So I can definitely share some of our best practice information with you after this call. In terms of writing your message, when you do write a text message, you are limited to 140 characters, and we do keep about a dozen of those characters freed up so that you can have an online link that you can click on your text message and it opens up the full message. The full message can have the description, can have the photos as I showed you. But when you have that text message, you are dealing with relatively few characters, and you want to get as much information as possible there. So keep your messages short. Make sure you put the child's name, age, description, where he was last seen, what he was wearing, any identifying marks, and then you will have that link that goes to the full message. The visuals here are the key, right? If 12-year-old Joe Smith is missing, you're gonna want to leave that space at the end so we can have that clickable link. But we'll definitely, with everyone on this call, share some of those best practices following this webinar.
Thank you, Jim. So the next question, this one's for Leamy. Actually, it's from the beginning of your presentation. Patricia Doobie was wondering, what does the initials MCD stand for?
Oh, Missing Children Division. Hi, Patty.
Okay.
Thanks. Yeah.
The next one was, are there any counseling available to Safe House, Ward of the State children?
Is there counseling available? So yes, through our family advocacy division, what they will do is for those who are in care and they get recovered, we'll work with the social worker. We don't work directly with the juveniles, but we'll work with the social worker in order to identify resources and counseling in the area. And so, and they try to get it on a pro bono basis. And so whatever services and support is needed, and especially in the child sex trafficking, and we do recognize that sometimes those are difficult to come by, but between our family advocacy division and our program specialists in the child sex trafficking scenario, they try to identify local services, and then they don't provide the direct, but they'll find resources in that area for that particular child, whether they're in care or not.
Perfect. Thank you, Leamy. The next question is actually asked towards me. It's from Alyssa. Jim, you probably will want to chime in. I'll answer the first part since it's directed to me. She wants to know, we use Nixel a lot for notifying communities about incidents happening in specific neighborhoods. Does every single Nixel get sent to NCMEC, or is it specific area we need to click to get them? So I'm going to let Jim answer this, Melissa, since Jim worked closely during the initial stages of the partnership and still does. So Jim, do you want to answer that one?
Yeah, absolutely. So Nixel has a number of partnerships, but two major partnerships. One is with the National Center for Missing and Exploited Children, and the other one, as I mentioned, is with Google Public Alerts. For NCMEC, any public message that goes out, and again, it's messages that you're sending to public groups, not your private, internal, sensitive messaging to your staff, any public messaging that would be viewed anyway by residents, all gets put into this feed that we constantly send over to NCMEC and goes through their filter. So it doesn't matter if you are sending a text, if you're sending an email, if you clicked on community or advisory or alert priority levels, it all goes over to them. On the Google side, although I know this wasn't part of your question, it will appear on Google's homepage if it satisfies a number of requirements, one of them being if it's an alert message, a red alert message. Only red alert messages will appear at the top of Google's homepage if it is you know, a missing child or a missing person, you know, of any age. But the NCMEC is all messages that go to your public groups. Excellent,
thank you. And Jim, is another question we got related to Nixel from Walter in the audience. He wants to know, do people, does Everbridge or Nixel offer an app or a special way to receive messages? Basically, how do they sign up for messages, and what are the modalities?
That's right. So there's a number of ways that you can sign up for messages, Walter. We do have an app. It's called the OneBridge app, where a resident can go to the online app stores, download it, put in, you know, some of their information to register. They'll be put into their neighborhoods, and then they will receive official notifications not only from their local public safety agencies, but they can also interact with their neighbors at a neighborhood level. So it's basically a digital forum in their pocket that your notifications will feed into as well. So it's another channel. We also pretty soon next month, I believe it's about mid-August, we'll be releasing an agency publishing app. So all of our Nixel and Everbridge agencies have a way to author messages on the go from a native application. So there's both sides of the application coin there, resident-facing and agency-facing. The resident-facing is out now. The agency publishing app will be out in about a month. And I'm sorry, about other modalities, besides the app, you can do text messaging, email, web messaging, voice messaging, and social messaging to Twitter and Facebook.
Excellent. And just one quick note on that. For Everbridge customers, there is a mobile app for publishing. This will be available, the new mobile app for Nixel customers, a new one that's coming out.
Correct.
The next question is for you, Limi. It's from Brandon. He wants to know, since NCMEC receives such a heavy caseload, referencing 2015, you guys had over 13,000 cases, what criteria must be present before NCMEC offers their assistance in any capacity?
Well, so in the critical sense, it really is we'll get an Amber Alert, or we'll get a Nixel Alert, or we'll get an NCIC entry that will suggest that there are some critical circumstances there, depending on the circumstances. And then we will assign that to a case manager, and they'll offer assistance, and depending on what is needed at that time. We receive cases from parents, from social workers, and so our case management teams, they work hard to try to, get through, and that's why we try to streamline some of the assignment process with our children with mental care, because that is sort of the bulk of what we're seeing. We're going to be seeing more of those. So I guess whatever case comes to us, we will definitely handle it and try to utilize as many of our resources as possible. And then on the critical front, we'll take a look, and if it's not already called into us by law enforcement or the parent legal guardian, and we get notified in some of the other manners, Amber Alerts, it's an automatic. We'll assign it to a case manager, and so that'll go. But our call center will take a look, and if it relates to a missing child, they will call that law enforcement agency and offer our assistance. And a lot of times with the Nixel alerts, they've already been recovered by the time we've reached out to law enforcement after receiving that alert. And there are times when law enforcement readily accepts, and there are times they say assistance is not needed at this time, and then we go forward, unless it's something pretty critical where we feel like, I think let's try to help and deploy Team Atom or get a case manager assigned and see what else we can do.
Awesome. So I'm going to go through two more questions, one for Limi and then one actually I'm going to quickly address. So we got a couple questions from a couple of our users, and Jim, you can probably chime in as well after I'm done. Josh wanted to know, he hasn't used the system before, but he knows of some of his neighboring agencies that leverage a free Nixel solution. Is that still available? So to answer your question, Josh, yes, we do have a free solution available. It's a great way to get started with Nixel and learn sort of the basic workings of it, and the power it can have to expand your voice, especially with situations like a missing person. And we do offer some more advanced plans as well that typically are leveraged by law enforcement agencies like your own to really maximize your reach and exposure to residents. I don't know if you want to add anything to that, Jim.
Yeah, absolutely. So when I quickly showed you the messaging interface, that's actually Nixel 360, so it is one of our upgraded versions. And Mike's exactly right. When you have the free account, which a lot of our agencies do, it gives you a really great way to send out text messaging alerts directly to all of your subscribers, and your messages will go to NCMEC as well. So everyone is included. What you won't get are some of the things that I click through, like geographically targeting your message, all of those different public groups that you saw that I had created there, as well as private groups, or Twitter and Facebook, like social messaging. So you'll get sort of the tip of the iceberg, an important component, but a tip of the iceberg on the free system. But we do have many folks who are utilizing the free system, and many folks who jumped from the free to one of the paid guys, depending on what sort of functionality they needed.
Yeah, and just one quick point to that. If you are interested, by all means, submit a question or send an email to marketing@everbridge.com. We can, or go to our web at nixel.com and fill out contact us if you want some more information on either solution. We do have them laid out on the home page, the government page, agency page. And one of the things you can find out too is, since we do have such an expansive customer base or partner base of partner agencies, over 8,000 in the country, a lot of times you already have some residents opted, or a good portion of your population opted into the solution because they either work in an area that's an agency and they put in their home zip code and work zip code. So definitely feel free to fill out that contact us form, and product specialists can give you some more information on whether something as simple as how to leverage the free system, check out the upgrades, or just see how many people are actually registered in your area. So with that being said, let me move on to the last question, and it's for you, Leemi. So the last question is, as an agency, where can we send resources, or do you have resident-facing resources that can help them in these type of scenarios with questions they might have?
Okay, can you repeat that question?
Yeah, so Joel wanted to know, do you have basically resident-facing resources that can address some of the questions that residents typically will have for law enforcement during these type of scenarios where there's a missing child?
Oh, so you're talking members of the public. So you said residents. So whether it is the community or if they have questions about. So we have our general website, and that's out there. There are key facts on there. There are what to do if a child goes missing. There are a number of publications actually that are available. So if there are members of the community who want to know, okay, well, what can our role be? There's some information on there. If you're talking about parents of missing children or guardians of missing children, then there are sections of our general website if they're not in state or foster care, and that's our www.missingkids.org. And so there's a lot of information there that can be a reference point.
Awesome. So with that being said, I really would like to take this moment to thank our two speakers, Leemi and Jim, for their great presentation, and for everyone in our audience for participating today. As a reminder, if you missed any part of the webinar, or you have some colleagues that you think they would benefit from this, I will be shooting out the email tomorrow or early on Friday. So just keep an eye out for that. And if for some reason you do not receive the email by then, feel free to go to our website, everbridge.com, go to our resources tab, and select webinars. And again, thank you everyone for joining us today. Have a great day.
Thank you all.
Thank you.